I always talk about the three pillars of health, and I've even come to think about it as a fourth recently. So there is the diet and lifestyle piece. Um, what we're eating is very epigenetic. So the second piece is our genetics, right? The genetic makeup. And that sometimes can create about anywhere from 1 to 30% increased risk. And there's a lot of misinformation around genomic testing that reveals certain genetic and genomic markers. But if you have a predisposition, the the most important thing is to look at the epigenetics, which is the environment you're putting the cell in, right? So if you look at the diet and lifestyle, you start to tease out some things that integrate itself together. So these loops that start to happen. So the diet is going to create whether or not the epigenetic response to the gene, whether it's opening or closing, behaving correctly, it's happy. And then you have the biome. And we have multiple biomes, the gut biome, oral biome, facial biome, skin biome, right? It's the organisms that exist, that cohabitate. I like to think we're kind of like a big space station. And because the universe that's in our gut, there's trillions of them. It's as unique as our fingerprint. And they will also dictate a lot. So if you're eating something that feeds the wrong group of organisms because they're social and intelligent, and then they're dictating to the brain how you're going to crave food, and you can get stuck in these little loops that happen. In the biome, we might see things like parasites or what I call non-pathogenic or non-parasitical pathogenic infections, where the balance is off. And so when people go to traditional medicine and they're having maybe like a colonoscopy, they're looking for things that are very surface. They're also looking for precancerous growths. Well, what's the multiple steps ahead of that? Looking at short chain fatty acid levels to see if there's enough butyrate, which is responsible for keeping a very acidic environment so some of these things don't grow. And then why is that depleted? Is it depleted because of age? Is it depleted because the epithelial cells are damaged because the intestinal wall is lacking integrity because of their diet? I mean, we get into what came first, the chicken or the egg. And so there's this other piece, trauma, the way that trauma can impact a developing immune system. And the way that we can get stuck in fight, flight, or freeze, our immune system can do that too. So often we're looking at, in autoimmune, say you take autoimmune, we're looking at their self-care, what's happening to sleep, because sleep is so undervalued. People see sleep as just a function, and I always say it's a state of being. You're either awake or asleep. And so in sleep, just as much is happening in your body, that happens when you're awake. You're detoxifying, you're rejuvenating. To me, one of the most fascinating things that happens when we sleep is our brain actually shrinks in size so that we can, through cerebral spinal fluid, move inflammation out of the brain. And the brain is neuroplastic. It develops plaque. In Alzheimer's, they're starting to think about people's sleep habits as a predicator for whether or not they're going to increase their risk, right? So you can have a genetic risk. People come in, I want to know my genetic risk for Alzheimer's. What about your epigenetic risk? What about your sleep habits? What about your glucose levels and your insulin levels in what is now being called type 3 diabetes in the brain? So we pay a lot of attention to diet. We do have to have the data often to convert people into believing that the dietary change matters. And so when I do an in-depth functional panel and I can show them different acid levels that indicate, okay, your phenylatic acid is elevated, it means that your small intestine is inflamed. And why is it inflamed? Well, let's talk about your diet. What are some of the things that you're doing to contribute to that? Yes, you feel bloated, and we want to eliminate the bloat. But your labs say you don't make enough short chain fatty acids. So we're going to come in with some butyrate to strengthen the epithelial cells, the integrity, create better acidity, change your diet. And then that starts to move them in a certain direction. So we're very heavy on diet. I think people don't realize how much they're contributing to their own inflammation, their own disease state by the things they're doing, because in this country, we undervalue food as fuel, food as medicine. We don't realize that food is either going to love us or hate us. We are dictating our food choices by an emotional response. Oh, I don't like that. Oh, I do like that. It's not about what we like or don't like. It can be, but if you've changed the chemistry even on your tongue and in the biome in your mouth, or in your gut, you might be sugar seeking. And that might actually create a chemistry where you're not making enough serotonin, which now creates a state of more anxiety and depression. So now you gravitate to sugar because you think that's going to self-medicate you because you get the high from it. But the only thing it does is perpetuate a loss of serotonin, and you're right back where you started from. So when we do these functional tests, we can help people say, this is the nutrient deficiency that exists. This is the acute state. Yes, your symptoms and your diagnosis that you have are what you come to us with. But when we tease out all the levels and the data, we say, these are the reasons why you have these symptoms. Your serotonin is low. Your adrenals are too high in cortisol. You're on fire in your fight, flight, or freeze response, or you're too low, and that's your depletion. It's affecting your hormones. And that's why your body temperature is dysregulated, or you've created a histamine issue. And so it's not really hormone imbalances. You're not really having a hot flash. You're actually having a histamine reaction. And so that sometimes can make people go, wait, what? Like, what? I came in, I thought I had menopause. Yeah, you don't, you know. There are other places around the world, underdeveloped countries, they have no menopausal symptoms. They just go through that change in their reproductive cycle. Well, why is that? The differentiating factor between underdeveloped and developed countries is that diet and lifestyle piece. And so we place a great deal of importance on being able to connect their functional labs and assessments to what they're doing to inspire them to make change.